there are quite robust governance structures that are brought into these kind of organizations, because these organizations are liable and accountable to the public. And if there anything is against the idea of interest, or there is a serious conflict of interest, those kind of things would be addressed, and the whole organization would go down on the basis of that. So even these pharmaceutical companies, even if we want to refer to them, I suppose there is a sense of accountability to them. If, okay, their incentive is solely financial, let's say, then if their vaccines came out tomorrow and they seriously harm the public, there goes that organization, there goes that manufacturer. Their reputation is complete. Nobody will ever trust them again. So there is this sense of worldly accountability that people have, if not even from an Islamic perspective. So that's an important point. Let's just move on to Mufti Amjad. So let's go on to the idea of ingredients and excipients within drugs, and in particular vaccines, because vaccines are quite different to just normal conventional drugs that we get over the counter or doctors prescribe to us. So I'm referring in particular to the impure animal substances found as ingredients or excipients in some of these vaccines, like porcine, for example. Can Muslims take such vaccines that contain these impure ingredients or excipients? Mufti Amjad.
نحمده ونصلي على رسول الكريم وما بعد السلام عليكم ورحمة الله وبركاته. جزاكم خيرا. Salam to everybody, panelists, and those who are listening. I just want to take a little step back first, if I may, and just to tackle a more general point. I noticed in your introduction, Dr. Rafaqat, you mentioned a number of caveats, treading carefully in how you pitch this discussion, because unfortunately it's very much a politicized or conspiracized conversation, especially when we get into vaccines. With numerous sort of articles and public appearances that I've made, I've received a lot of kind of correspondences and somewhat quite heated and quite emotional correspondences, more than usual. So I just wanted to touch on a few points. First, with regards to a fatwa is a snapshot of a situation which is occurring within the community. Sometimes the community are eager to say, yeah, but what's the impact of this vaccine 30 years from now, 40 years from now? Can you not take that into consideration? Unfortunately, we can't. We have the data that we have, that Dr. Aasim Saab just mentioned now as well. We have to give a response based on the data that we have. So then that's one point in terms of what a fatwa is. Secondly, we seem to also conflate ethical issues with the legality of a particular matter. So when we give a fatwa about something, we're looking at its permissibility rather than, what about the pharmaceutical companies making lots of money out of this? What about certain people that will be impacted on the side effects that will occur as a result of it? And thirdly, which I guess is more important, is our role to kind of articulate the moral code that the Sharia is. We don't live in a Sharia state as such in which we can enforce anything. So this is just about bringing about informed consent or informed choices. And it's really about individuals to make that particular choice. And then I just lead on to one other point before I answer your question directly. So neither Wifaqul Ulama as an organization or neither I as an individual have recommended either this particular vaccine or any vaccines for that matter, or even further still, any type of medical intervention. As a Hanafi, we see it as something which is permissible. And that's something that that's a position we take even with this vaccine, that is a permissible intervention to take. So it's not about promotion, and it's not about anti-vaccine ulama and pro-vaccine ulama. I think, unfortunately, if we're being perceived like that, then it's something on our case that we've not really been clear in getting the information out there, or people are seeing biases in our research which don't exist. We are supposed to be approaching all forms of research with a tabula rasa. We're looking at things fairly and accurately now, and we base a decision on that. So I think that little kind of my little caveat or background, I think is important for all to take into consideration. So with regards to your specific question, Dr. Saab, there's a number of factors which obviously need to be taken into consideration. The efficacy of this vaccine or any vaccine which has animal sort of any animal ingredients or any stabilizers or anything else for that matter, and other vaccines which may be available that don't have any illegal from a Sharia perspective ingredient in there. the underlying health issues of the individual that's being asked to take it. It's not that every human is the same. So it's not just a case of one shoe fits all or one medicine fits all. It's a case of what's the underlying health issues of this particular individual, and what would this person benefit as an individual from this particular vaccine. And then it's looking at probable outcomes, you know, ghalib al-dhann as we understand it. What are the probable outcomes of taking this particular medicine or vaccine rather? And then we touch on the last point, which I think Dr. Munir Sahab was also speaking about, which is the herd immunity or the herd immunity threshold. At what point, you know, can we sort of say, well, you know what, we're not gonna, we shouldn't take this vaccine or any vaccine for that matter, because of the fact that it's something which, if we don't, as long as many people do, then we'll be all right. It's about where is that threshold, and not all diseases have the same threshold, so it varies. So again, you know, I think we, or the public, or maybe we, I don't know, or all of us, we oversimplify lots of things, and we, as you know, as the saying goes, we throw the baby out with the bathwater. There's a lot of things which need to be taken into consideration. You know, I don't personally gain from anybody taking the vaccine or not taking the vaccine, and I'm sure that's the case also from the respectful panelists here that are also speaking. So I think that hopefully answers your question, Dr. Sahab.